We will talk about amblyopia or lazy eye. First, let's define what is amblyopia. Amblyopia means when one eye's visual acuity is decreased importantly compared to another eye. Idea is that our brain prefers one eye and get information from this one eye and ignores second. So in person has very low visual acuity in one eye and second eye is dominant. It's very important problem, especially among children, because amblyopia occurs around 3% of children. And early diagnosis is crucial because at early ages, especially before the age of 7, amblyopia or lazy eye is almost 90% curable. But after this age, it's difficult and results are not so favorable. So diagnosing and treatment of amblyopia at early ages is very important. Now let's say what causes amblyopia, why it happens that our brain favors one eye. Most common cause is misaligned eyes. What means misaligned eyes? When eyes are crossed inward or turned outward. Here you can see that this eye is turned outward. It's misaligned eye. It is called strabismus, and strabismus is most common cause of amblyopia. It's responsible around 30% of cases of amblyopia. Why it happens? It happens because our brain gets information from both eyes, and when one eye is misaligned, brain tries to ignore information from misaligned eye and get information only from normal and dominant eye to avoid double vision. That's why it's compensatory mechanism actually. That's why we have amblyopia. Another cause is important refractory errors. When kid has refractory errors, for example, hyperbiopia or myopia, farsightedness or nearsightedness in simple language. When these refractive errors are important, our brain still finds way and tries to get information, get light from normal eye and ignores from defected eye which has important refractive errors, and we get amblyopia again. It's compensatory again. So our brain always try to avoid double vision. That's why when there is important refractive error, brain also tries to avoid double vision. That's why we get amblyopia. Also, third cause is congenital cataract, for example, when light cannot reach to retina and it's blocked and we have obstruction. As this case, also amblyopia develops. And also we have strong genetic basis. If one parent has amblyopia, kid has around 13% risk of amblyopia. And if both parents have amblyopia, the risk increases up to 20%. So if both parents have amblyopia, kid has 20% risk of amblyopia. So it has strong genetic basis, but exact mechanism is not known. We don't know why it happens exactly, but we know that genetic component is involved. Now let's say about treatment. Treatment is crucial before the age 7 for favorable and optimal result. We have different types of treatment methods, and most important treatment is eye patching or eye covering. Every day for several hours, we cover 1A, which we cover normal eye, we cover dominant eye, and give time and force brain to get information from eye which is affected and which has amblyopia. So we train brain to get information from affected eye. That's the idea of patching, and our brain has neuroplasticity, and our brain develops and starts learning to get information from affected eye, and amblyopia improves importantly, improves in almost 90% of cases. It's very high treatment, very high effective treatment. Second type of treatment is atropine drops. What atropine is doing? Atropine dilates pupil. Also, atropine paralyzes ciliary muscles, and eye is unable to focus anymore. So we get blurred vision. And if you instilled atropine in dominant eye, not affected eye but dominant eye, you get blurred vision in dominant eye, and brain starts to get information from affected eye. Again, mechanism is same as patching, because in both cases we train brain to get information from eye which has amblyopia and which is lazy. This treatment method is also effective, but slightly lower effectiveness, around 70% effectiveness. Sometimes we can say it's around 80% effectiveness. It depends. The younger kids, the better results usually. And third treatment method is vision therapy, eye exercises. It's also important, and it has important role also, and effectiveness is around 60%. It depends, of course, individual factors. And now let's say about adults. Here is important questions that, yes, it's understandable that among kids we have great results, but what about adults? Recent studies is promising, because according to recent studies we know that treatment of adults also effective, of course not such effective as in young children, but we have promising studies, promising results. For example, atropine therapy, low dose atropine therapy, 0.01% atropine per day, 1 or 2 drops once a day for 6 months, had effect in adults. So atropine has some important effectiveness also among adults. Not such high results as in young kids, but in adults also atropine has some degree of effectiveness. Another method which is important is binocular therapy. Binocular therapy means training both eyes to work together. Idea is simple. We have usually it is implemented in virtual reality, and when we get 2 images, one image, for example, for left eye is, if left eye is affected, for example in my cases left eye is affected, and one image is with high contrast, vibrant colors, and second image is very blurred and or low contrast, but they are one image, and our eyes sees different images, but these different images have connections, and we need information from both to complete task. So our brain learns to cooperate between these two eyes, and it gets more contrasted information from affected eye and less information but also important information from dominant eye. And it's important because our brain starts to get information from both eyes, and this binocular therapy is important. And neurovision is also important and promising treatment method. Neurovision idea behind neurovision is that you exercising your lazy eye, looking at images and patterns and details, and these details and patterns are exactly slightly above threshold your vision. For example, if your vision is 60%, these details are from 65%. So you starting learn to differentiate details from 60 to 65. When you already adapted to 65, you get 70 and etc. You you get more details, you describe more details, and your brain exercising, your eye exercising, and visual acuity in your affected eye improves importantly. That's the idea of neurovision. So, to summarize, amblyopia or lazy eye is common condition. It affects children, usually from newborn stage. So we should diagnose them earlier and earliest possible. We have treatments. Treatments are eye patching, which is very effective, atropine therapy, effective, vision therapy, effective. In case of adults, we have atropine, low dose atropine, binocular therapy, and neurovision. They are promising methods of treatment of amblyopia. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.